You are here for the Are We Paying Attention to the Signals webinar? You are in the right place. This presentation is being brought to you by NEA's ESP Quality Department, which is housed in the Center for Professional Excellence in Student Learning. The ESP Quality Department represents and advocates for over 400,000 education support professional members, also referred to as ESP. ESPs serve as fellow educators in the school community and play an important role in supporting the whole student. Our strategic focus is to elevate ESP careers by developing, implementing, and promoting best practices, policies, and professional supports that equip ESP with the knowledge and skills to become empowered leaders, accomplished professionals, and members of a high-quality workforce, prepared to meet the needs of all students. At this time, I would like to pass things over to my colleague, Sheila Caldwell, who is joining us as a nursing fellow in our ESP Quality Department. So welcome, Sheila. We are all looking forward to your content tonight.
Thank you so much, Jessica. Good evening and good afternoon to those of you who are out there on that West Coast. I'd like to welcome you this evening to this presentation that I'm going to give titled, Are We Paying Attention to the Signals? Our lifestyles, environment, and bodies are trying to tell us something. First, I want to just say I'm a school nurse in New Jersey, and I was invited to a fellowship here with NEA as their SIP fellow, which is a specialized instructional support personnel fellow, which are the non-classroom facing educators who are in the school, the licensed professionals. So we are going to start with a poll. And the first poll we're going to see, although I know you've been putting some information in the chat, who is here this evening? So take a look at the list and select which profession you are from, or if you happen to be potentially a non-educator who's a professional. And we'll give you a second to answer that, and then we will just see the results in a minute. Okay, so if you want to put up the results, please, it would be appreciated so we can get a feel for who's here in the room. So the majority of the people here are ESPs, Paris food service, bus drivers, secretaries, and thus there are some SIPs, some teachers, and other educational professionals, in addition to a few non-education professionals. So we're moving on to the next question. So because of the title, has your own personal health been of concern over the past month? Just answer yes or no. Remember, this is anonymous. We do not know who's responding to these questions. It just pops up into the poll. Okay, so I guess this is a simple one to answer. So if you can please share the results. So this is quite telling that we do have 79% of the people here this evening who are concerned about their own personal health. Okay, and our last question, have you sought out professional, medical, or behavioral health assistance over the past month? There's a few different options here, so take a quick look at, scan those first before you respond. So those of you with the 79%, it's going to be important that you really start looking and taking care of yourself as we move on. And if we can see the results of this question now, we appreciate it. Okay. So we see the results, and glad to see that a good number of folks are seeking assistance outside of their home and from a professional, whether medical or behavioral. And The folks that haven't, if you still are dealing with something, be sure to reach out. And I do understand wholeheartedly the folks that plan to, but time gets in the way. We are so busy with our lives, and things happen. So thank you for responding to the poll. And now we are going to move on with the presentation. Next slide, please. So these are the objectives, and just putting them up there for you to read. And as you can see, the items that will be covered during this presentation. We're setting this up more like a professional development presentation, so that's why this is set up in this fashion, as you can see. Okay, and take a look at those for a second. All right, next slide, please. So last month, we learned about self-care if you participated in the NEA ESP webinar. And we are looking now deeper into the effects of all those things on our body, our lifestyles and the environment, and even the pandemic, and what they have done to our body. We go to bed with the expectation that we're going to wake up the next morning without any real thought about what is happening to us internally. Or if there's anything external or visual that others can see, we don't consider the toll that this takes on our body's systems, organs, and even individual cells. We rarely pay attention to the beating of our heart or its importance to our being. So I'm going to first take you back to approximately 3rd grade, because we have to first conceptualize the interconnectedness and interrelatedness of what is in fact keeping us alive. We all learned about the body at some point in our educational career. We learned how the cardiovascular system, once called the circulatory system, was key to circulating the blood that carried all the nutrients and energy for each and every cell in our body in order for them to thrive. We learned how our digestive system takes the nutrients and other components that we eat, moves them into the circulatory system, and it also to nourish the body and the cells. And how the digestive system works in tandem with our excretory system to remove toxins and waste from our bodies. We learned if not for the body's need for oxygen that we take in via the respiratory system, cells would not thrive. The respiratory system transfers the oxygen to our cardiovascular system for cells consumption and releases some toxins as well. The musculoskeletal system is there to allow us movement and maintain upright stature. The integumentary system, our skin, holds us all together and keeps all these systems and organs and things housed. The nervous system that controls all of our body's internal environment allows for memory and learning, allows for voluntary control of the musculoskeletal system, and is in charge of all the reflexes. The endocrine system that regulates all bodily processes throughout our lifetime: metabolism, growth and development, reproductive function, blood pressure, appetite, sleep and awake cycles, and more. Our immune system is the system that is the main protector from outside invaders and infections. This is a system that has a tremendous amount of focus in light of the coronavirus and the pandemic. And lastly, the reproductive system, that if not for it, none of us would be here. We know that if there is a failure in any one of these systems, the domino effect is harmful to the organs, tissues, and even can be fatal. All of the cells, organs, tissues, and systems need to be functioning optimally for good health. Next slide, please. So take a look at this slide and the questions it poses. Do we ever really stop and say or think to ourselves, I wonder how my body's systems, organs, and even cells are doing? Are they responding in an appropriate manner based on what I do, where I live, what's going on? Am I taking care of them? I know this is a foreign concept to many people, but as we look at the many self-care strategies today, the general premise is learning more about our body, its inner workings, and how harmony can be created. Think about meditation, yoga, and other methods that have become more popular in the mainstream lately. They are all about your entire body's cells, organs, and systems working in a manner to give you balance, or homeostasis, if you remember that term from school. Our bodies crave to be in such a state, but influences, some of which we can control, and even some of which we can't, do not always allow for this to occur. And we are also what research us about this effect. Individuals who have tested positive are going about their daily lives, when internally there may be some lingering effects that might potentially show up years from now. It is really something that we should be thinking about, and how our health or the health of the children could be impacted as time goes on. We really don't have the focus of this right now. The research is just really beginning. Individuals who are post-COVID infections may end up turning up with other things in the future, as I said. So over the next few years, we'll likely learn more as more research comes out. And this really makes me think about, and I'm not sure the age of many of you, but it makes me think about the 9/11 incident and how we were so anxious to help our fellow man and in the search and recovery and the cleanup and those things, and at the locations that were hit. And at that time, we were told that we didn't have to worry about health concerns. But since that time, we do know there have been individuals who have been diagnosed with an array of conditions that point directly to their working in those 9/11 locations. Researchers did not find this out until years later. Now, today, there is some speculation about COVID-19, but only time will be the true teller. For now, we should all keep in mind some of the base information that is being found, like brain fog that is lingering in some individuals that have post-COVID. So it's important that we start really looking at our health and things to improve our own health. But let's now speak about the vast array of external factors that can affect our bodies, no matter our age. External influences are broad, and we're going to take a look at their effect from a few different perspectives. We're going to start with ACEs, adverse childhood experiences. We will definitely get back to the conversation about our bodies soon. Next slide, please. So if you can see this slide, these are the base factors that relate to when the ACE study was developed. We were all children at one time, and external influences within our households and families do occur, as we know. These influences can produce lifelong changes in our mental, physical, emotional, educational, and overall well-being. We might not speak to them much, but internally, they are there. And they may have happened in our youth, but they linger on through our adulthood. So basically, the ACE study occurred in the late 1990s, and it asked 10 questions. I'm just giving you a brief overview about it. And the questions were related to the 10 factors that you see on your screen. And the responses were either yes or no, if you have experienced them or witnessed them in your life, in your lifetime. And once the numbers were calculated and totaled, there is a rubric to determine one's ACE score. So this score is just an indicator of risk. It is not a definitive diagnosis or anything like that. It is a score that through research has shown some predictors of health risks. Excuse me. We will speak about those risks shortly too. At the end of this presentation, you will be given a link to the ACE study questionnaire. So just take a moment to look at this slide. Surely you know someone, a family member, a friend, a colleague, or possibly yourself that has experienced at least one of these factors or been, witnessed. We all can reflect, and it's important that we take this into consideration as an external factor that is affecting our health. Next slide, please. So, being more than 20 years out from the original ACE study, there had been more research about it and the realization that there's even more external factors that can affect one's health. Let's look at this slide. This slide now incorporates in adverse community environments, and thus this is why it's called a pair of ACEs. As we're going through all these slides, I'm sure you can start to see the connection to your body and potential signals of your body's systems, organs, and even cells, and how they can lead to increased health risks and health conditions. I'm just going to give you a moment to look over this slide. So now, let's shift gears again and look at it from a different perspective. Social determinants of health. Next slide, please. Social determinants of health, or some call them social influencers or even social drivers of health, they are the conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. Let me just say that again. They are the conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. As you can see from this slide, it is a bit different than the ACEs slides because this truly looks at systemic and environmental factors that contribute to health outcomes. So let's look at each column, and we'll start from the first one. And think about an individual, a family, a group, or even a community that you're aware of concerning this. Let's look at medical bills. We all acquire them. What is key is if we are able to pay them. Do we have insurance coverage? Do we even have a job? Do we have coverage that is enough to cover the plan? Did we have to choose the higher deductible plan because we needed more money at home on a daily basis to pay for other things? Next, let's look at parks and playgrounds. We're going to look at those together. Are they well maintained? Is there enough lighting? Are they safe to be at? Did the town choose to use rubber tire pieces that are infested with lead as the cushioning under the swings and slide? Is the slide even functional? Literacy is in the next column. This is a major concern. And as we speak about literacy, we can speak about it from a number of perspectives. We can talk about it from the idea of those that do not understand English language well. Possibly it's because their comfort level is better in their own dialect or language, or they get a better understanding of conversations if their own language is utilized, or even when they have to perform a task. We can also speak to literacy from the perspective of health. When any one of us goes to a healthcare setting and those in the practice start using words, the medical jargon that we're familiar with hearing, although we may not always understand them, this is a health literacy problem. A number of years ago, the United States had put out a full push of an initiative to have clearer health literacy for all individuals. The use of more common language in print and in speaking. And if you do not understand still, explanations as to what is being provided to you as far as your medical care. There might even there might need to be another time set aside to have these conversations, but you want to be an informed consumer in your educational understanding of what is going to take place to you medically, especially if you're consenting to a procedure. Access to healthy options. We know this is a major concern in this country. There are food deserts throughout this entire country. This is such a major concern that the nation's United States Department of Agriculture has even created a food access interactive map that you can search and see where the food deserts are. Then, support systems. What social supports are available for our children, for the adults? Do schools have systems in place that can support families? Are the schools functioning in a capacity of community schools? Do the local hospitals, businesses, or organizations recognize the support needs of individuals, families, and communities? We know sometimes there's a major disconnect in what support systems are available. They might obtain a grant and it's to address the situation and not have gotten the input from the community. And the community, individuals, really don't think it's the problem. They have a different thought of what their need is. This is why it is so very important for businesses, organizations, and other community groups, and even our local government, to ask individuals what they need, perform needs assessments, include them in creating other solutions and strategies. What might be good for one individual family or community might not be good for the next. But there has to be some consensus for solutions in order to have better health outcomes. What is important to keep in mind, though, as we talk about this in systems, is that individual needs are not necessarily the ultimate goal. When organizations or businesses or those set goals, they are looking at it from a population health perspective, which means they're looking at it from the general understanding of what is good for the many. Meaning that when all factors are assessed, the goals and solutions are thought of in a general sense. We have seen this in public health decisions lately in relation to the pandemic. And you can surely understand why this was done. And finally, concerning this slide, look at that bottom section that's in orange. The actual healthcare systems, and finally, concerning this slide, the actual healthcare systems themselves are providers available to you during the hours that are convenient for you. Are they convenient for you? Do you have to miss work in order to attend a appointment? Do you lose pay? Do you risk losing your job if you take off? We could go through all of these, and surely at least one of these determinants, either you, a family member, a friend, or another have experienced, especially during this pandemic, and they have likely experienced them prior. They can truly take a toll on one's body. And as I'm saying now, the orange section at the bottom notes the potential health outcomes that can be presented. If there's no balance, that homeostasis, we know these can occur. So now we're going to just take another look at this image, but we're bringing in another dynamic. Next slide, please. If you noticed on that prior slide, discrimination was in that last column. But as the Kaiser Foundation has been continuing their research, and as we have noted during the pandemic, we can see how racism and discrimination can't be isolated to just one area. Racism and discrimination across the board are major factors that play a part in health outcomes. The statistics related to the COVID-19 deaths speak to that. More people of color, in terms of percentage, died of COVID-19. Another area that we know is being highly researched is in maternal and infant mortality and health. Many states even have created initiatives and legislation around these disparities. During childbirth, Black mothers and Black infants are noted to die at higher rates than their counterparts. There are many health studies that are delving a bit deeper into looking at race, ethnicity, gender, genetics, and more. They are really drilling down on health outcomes and solutions that can give us more information about improving one's health and healthcare. Next slide, please. So we're headed back looking at ACEs again. And this slide pulls in the ACEs information and the social determinants of health. And it crosses over with the social determinants of health and looks at it from the perspective of COVID-19. The impact we have seen in schools, the disparities we have witnessed within homes, communities, states. And if you haven't witnessed something, surely you have seen such information occurring on social media or on television. Within our own circles of influence, we've had conversations with others about these issues and how they can be addressed. Many of us have even participated in local initiatives to help, or even been on the receiving end of some of the supports related to the pandemic, or even pre-pandemic. These factors are still very prevalent today and affect our health on the daily basis. So let's view this more. Next slide, please. So this is basically the same slide, but now we have factored in more distinct environmental factors. Our country and even the world is experiencing so many of these right now. Take a minute to look at this slide. You'll see in that number 3 where it talks about weather conditions and pandemics, et cetera, that this really throws in that next piece of information to what we're seeing being experienced in households across the nation. Because of all these things, we're back to that very beginning slide that has to do with ACEs and how households and families are responding and how the interactions are getting a little more tense within homes are occurring to cause some of the other issues. Next slide, please. So ultimately, the majority of what has been spoken about thus far in relation to ACEs, social determinants of health, disparities, inequalities, inequities, are also familiar to us. And this is just showing us that then there is the reality of what things are actually like and as they relate to our health. But we're always looking to find a better way and for things to get better. And if you'll turn to the next slide, please, you will see that we are hoping that one day we will attain some form of liberation and inclusion and that everyone will have equality. Just reflect on what we have discussed thus far. So now back to our bodies. Next slide, please. So we're going to start off this part of the conversation by looking at this image. as you see, it now even adds another dimension to all that can be these external influences or even internal influences on our body. This one happens to talk about more internal initially, genetics and generational factors. They affect the health and well-being of our bodies as well. There are the things that we cannot change related to our health that are passed on from our family line. And then from the external view, the conditions that have perpetuated due to our family dynamics, culture, and external to our family, in addition, are historical trauma that many marginalized groups are affected by. Now, you might not be as familiar with the terms that are on that right side of the slide: microaggressions, implicit bias, and epigenetics. But let me give you a quick definition. Microaggressions are everyday actions and behaviors that can have harmful effects on marginalized groups. They may or may not be intentional. Implicit bias is a form of bias that occurs automatically and unintentionally that nevertheless affect judgments, decisions, and behaviors. Epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. We can also mention that due to the pandemic, we are all experiencing collective trauma. That is, trauma is traumatic psychological effect shared by a group of people of any size, up to and including an entire society. So take a quick look at that slide and you can see that information there. So now, can we go to the next slide? We'll start to look at stress and conditions associated. Remember that there are stressors that are actually normal and expected. For instance, if you were in a situation where your supervisor was going to do your evaluation and said, I'm coming to observe you right now, you're going to maybe get a little sweaty in the palms, maybe your heart will race a little bit, you'll get a little nervous, and but in your mind, you're thinking over, I know my job, I know it well, but still, what might that person see? What might they think? What might they do? And you need to take some deep breaths to try to get yourself through it. But once it's over, generally, you're going to return back to your baseline function. You're not going to be as upset about it and worry about it. And as you see, that there are some of those symptoms noted on the left side of this slide. And that is an example of a short-term stressor. And you can look at that list on the left side of the short-term stressors. On the other hand, long-term stressors can cause health conditions that might even need professional medical and or behavioral interventions. Take a look on the right. Some of these effects can affect us. These are more often related to stressors that are frequent, that we would experience almost on a daily basis, that are related to that imbalance and that lack of the homeostasis. When we mentally are faced with these situations, that we might know, when we are mentally faced with these situations, that we might know a solution to, but a solution is not attainable, some of these bodily responses can happen. Things like, where you can't take care of your kids because you don't have enough money to buy food. And if this perpetuates day after day after day, you may experience headaches, you may experience stomach upset. It may get to the point where that homeostasis within your body is really out of whack. I'm not going into those technical and the physiological details of how the chemicals in our bodies really respond and cause all these systems to really go out of whack. But know that it is all about balance. If there's any prolonged imbalance, our organs, tissues, and systems become affected. Our bodies are always giving us signals when it is not in a state of balance. Many of the symptoms could mean different things. So it is important to have healthcare provider evaluate. We know that one type symptom could mean many things. Think about this. Shortness of breath doesn't always mean that it's your respiratory system that's a problem. It might mean that it's your heart, that it's your cardiovascular system. So it is important to pay attention to what your body is trying to tell you. We can think about symptoms that the CDC has shared in relation to COVID. And if you think about them, many of them mimic symptoms that are similar, that are in diagnoses of seasonal allergies, asthma, cold, flu. It's unknown unless these are tested for. You can see that list on the image as it relates to stress. But we can speak more about some related health conditions that can arise if the imbalance is prolonged. We know heart disease, we know kidney disease, we know lung disease, and so on. If we allow the imbalance within our bodies to keep going on, we can easily develop any one of these. So here are some symptoms that you surely should have checked out by your healthcare provider. The list is not exhaustive, and by no means am I implying that you take them lightly. What I'm saying to you is if they are severe or if they are getting in the way of your work-life balance, call 911, get to a hospital, contact the provider, but do the best course of action for you. And they're here. So here are some of the signals that our body could also give. And this, as I say, is not an exhaustive list. Your blood pressure is high. You may have a drooping of one side of your face. You may have leg cramps. You may have heartburn. You may have loss of memory. You may have excessive thirst. You may have confusion, sleeping more than normal. The list can go on and on. The main point is if you're experiencing any different feelings or thoughts, seek medical attention. There are many different infographics available online that relate to different disorders and from reputable organizations like the American Heart Association or the American Lung Association. You can look those up as needed. But as I say, many symptoms cross over between varying diagnoses. Next slide, please. So we're looking back to the ACEs again. And this image speaks of the potential lasting impacts of having more than one ACE or even an ACE. Keep in mind that anyone can overcome adversity, okay? That is so very important to keep in mind. Just because you may have experienced an ACE or ACEs in your younger age, you're not locked into developing these conditions. What this is from is, as it's been studied with the research, these are some of the things that they have seen happen most often based on the type of ACE it is. So if you can see the spokes, there talks about different things, and the bubbles are the potential outcomes. The first one, for instance, is like injury, and it talks about, injury from the perspective of being battered or something like that. And we know it could lead to brain injuries if the head is the source of the impact. If other parts of the body are a source of the impact, then we can have some broken bones. It all depends on the source of where the impact is. Take a look at some of those other spokes and some potential conditions that could arise. Remember, when we speak of ACEs, all the medical impacts overall are based on being exposed. But the biggest key about ACEs is that our psyche is somehow affected. And so that's why it ends up being the likelihood that some of these conditions can occur, and the risk gets higher for them to potentially happen. Next slide, please. So I'm sharing these images as every 10 years, our country sets forth goals to attain during the decade that's set forth. Okay, and it does it in the thought of population goals. Remember what's good for the general group? Each state, even individually, develops their own set of goals. And even within some counties, they create some of their own health goals. Okay, but right now, as I'm looking at this and speaking, this is about the national perspective. The topics for the years starting in 2030 are already posted. So you can actually go to their site and see those. But let's talk about the 2020 leading health indicators, those and the goals for those. Most have been on the list since the Healthy People Initiative started in 1979. I'm sure you can name at least the 3 of the indicators of health that the country has been trying to combat. But know the idea of these goals is to address the overall health of people in the country. There are organizations and states that apply for grants to address these. As far as the indicators, I will mention a few of them. And we'll read them from you from the 2020 list. And as I say, I've already talked about some that have been already included in the ACEs or the social determinants. And so here's their current list of indicators: access to healthcare, clinical prevention services, environmental quality, injury and violence, maternal, infant, and child health, mental health, nutrition, physical activity, and obesity, oral health, reproductive and sexual health, social determinants, substance use and abuse, and tobacco use. So the question really comes in, as far as each one of us is concerned, is what can we do as individuals to improve our health? When I speak of health, I'm talking about all aspects of health. We must take responsibility for the aspects of our own health that we can control, and then consider what the system and what other supports can be put in place outside of our control area. There has been a lot of discussion around self-care. And as individuals, we do need to take ownership of what we can do for ourselves. But we know all these external influences are major. What can they do about it? What can schools do? What can communities do? What can our government do? What can our other associates do? There's no denying that each individual cannot do it alone. We can talk about it and all these external factors, the social determinants of health, the drivers, be done to change them so that we have better health. Discussions about systems needs to be approached by each community or communities of individuals to come up with some solutions and share them. Think about the people in your sphere of influence and how you can start your conversation there. Reflect on all that has been discussed this evening, and surely you can come up with solutions and some individuals you know that you can reach out to. So now let's go back to us as individuals. A good place to start is with you and what you can do to balance your life. Here are some personal things that you can do. Make sure you're getting enough rest. Try to eat appropriately. Make sure you take breaks. Look at your busy schedule and see if you can carve out even 10 minutes twice a day to take that walk, even just outside your front door down the street. I'm not going to offer you absolutes, as only you know your situation and circumstances. But start with some small steps and try to stick with it as much as possible. Next slide, please. Okay, so this slide has the Healthfinder.gov imaging. Now, on this website, you'll get these in the resources, but on this website, you can plug in a few demographics about yourself and get a list of health considerations. It will provide recommendations for information that you can speak to your healthcare provider about. The age you should have annual tests done or screenings done, and other helpful information. It's a good starter tool for opening up conversations with your healthcare providers and knowing that maybe things like a mammogram, at what age should you have it? Every 5 years if you're a female, and every year, as you get older. So it's a good base tool, as I said, to spark conversations about your health and how you can have it addressed. I know many times the communication with health providers, as I said prior, is rushed, and they want to move on to the next patient, or another patient comes up and, or this nurse or someone pops in the room while you're even having your exam and having a conversation. But remember, you have patient rights that are afforded to you. So they do have to take the time with you. They might not be able to take it right then and there. You might need to set up another time, but they do have to talk to you about different things related to your health. You have to be that informed person. Also, remember, most insurance companies allow you to change a provider if you're not happy with them. Don't think that you are tied to one provider. You do have options, usually 2 or 3 times a year, that you can change your provider if you're not happy with them. And insurance companies, if you have one, they even have some case management programs where there are healthcare professionals checking up on you periodically if you do have a chronic condition or something that warrants more in-depth communication with you on a regular basis. Next slide, please. So some other resources to consider in light of the pandemic. NEA and your local union probably have services that you can tap into. You can go to NEA's website that I have listed on this link, and it will be in your resources to learn more about information that's available. Your local union association likely has recommendations and or even some kind of discounts for nutrition programs, physical fitness places, or even employee assistance programs. It's important that you know about employee assistance programs. They are confidential and you can contact them for assistance. EAPs, as they're called, can help you navigate your health. If you're struggling with medical, behavioral, or even some other conditions. I do know a number of educators that have used their assistance of their EAP, and it has helped them through the pandemic. Their health conditions are in better balance, and they're able to function and work in the school, obviously still stressful at these times, but they're still able to function. And it has got them through without losing their job and those types of things. So think about this as you're looking at what options you may have available to get you through. This is one of the major keys, is how to keep your body in balance. Understand what you can and cannot control. And your healthcare insurance carrier, they might have wellness programs or other things available. There are support groups in communities that are available, in each state and in communities. Some of these are available within your own school, potentially. The key for you is to ask. What resources are available to me that can help me with my medical, behavioral, or other conditions that I need to have in balance in order to be able to function and work. There are opportunities basically everywhere. You just have to know that you can have that opportunity to ask. Next slide, please. And this is a program that the Federal Communication Commission has in place, 211. It is a service that acts to access essential community services. It's a number you can call from anywhere in the country. You end up providing your zip code or some reference to where you live, and you let them know what type of assistance it is you're looking for. And you will get a response, maybe a list of agencies, organizations, or services that are available to you that are within your direct community and or within close proximity. But just know that this is available. Next slide, please. So now that we've discussed our bodies, the environments we live in, working, playing, learning, as well as other factors that take a toll on our health, I want to leave you with this short video that is a reminder that health is not only about eating right, physical activities, and going to the doctor. I mentioned some of these dimensions briefly, so let's watch. If you can start the video. So here's the list of resources that are being provided to you related to this presentation. And we are moving on to the next slide. You will receive those at the end. Slide, please. So if anybody has any questions, I'm going to try to see if I can find this chat.
I'll help you with that, Sheila.
Okay.
So thank you so much for all of that information that you shared with us this evening. It was very informative, and we definitely know with the period in which we're all living through, as you point out, of collective trauma with the pandemic, that it's very helpful to get a better understanding of what it is we're living through. And so as we are going through some of these questions, so far there are only 3 questions that we have in the Q&A feature. If you have more questions, please begin to type those into the Q&A chat so that we can ask Sheila while she is with us. So the first question that we have was in reference to the first pair of ACEs image that we showed earlier on. And the question is, why is just maternal depression included in that diagram and not paternal depression?
And we probably all could speak to that because, you know, as our world has evolved, the maternal person is the person that they associate closest to the child. So when studies were done and all that, they didn't look at the father. But I must tell you, there are some looks at paternal situations at this point in time. So I'm sure over the next 5 or so years, we'll start to see some research coming out about the father's role in you know, childbirth and child rearing.
Okay. We have another question that says, how can you recommend I bring this content to my school? I'm a school-based SLP and work between 2 campuses.
Well, this will be shared with you. It's important that you take the pulse of, is your community of educators and teachers ready for this information? Will they be receptive? But it's something that you do want to bring to light to them. And so they can really start thinking that, you know what, it's more than just them, that we are all in this together, that individually there are things we can do, but collectively there are things we can do. And there's things that also beyond us and us as individuals in small groups can do. I think just putting it out there and hosting some type of presentation that talks about this topic. There are speakers, I'm sure, that if you ask in your district, if you have a social worker, they may know somebody that does presentations similar, and or maybe even your local or your state affiliate. They have programs and conferences usually on an annual basis. So there are presenters out there that would probably speak well to these topics.
Okay, the next question. What role should our local and state school nurse associations play in offering self-care activities?
So when we think about self-care, as I say, we have to start with ourselves. When we think about organizations, no matter what the organization is, they have to look at the organization as a whole. So this goes back almost to that thought of the population. Let's look at the whole population and see what the needs are. So there really should be some type of questionnaire coming out from them, asking, you know, about how people are doing. What are they feeling? How are they foreseeing, or what might they think could help them, and start from there. That would be the best way. And then as that data is collected, determine what type of approaches it could be. Many places are possibly not still doing things in person. It may have to be in a setting as this. But then again, you know, it might be something where you can do something in person. But even in this setting, we can Zoom rooms can be set up, breakout rooms, and all that kind of stuff can be set up. So organizations can do, but what they need to do, similar how I mentioned before, is do a needs assessment and find out what it is that the people really need that are of their organization.
Okay, the next question. Do you have resources that I can pull from for individualized presentations to my schools if the administration is receptive to my offering such?
Well, I've included some that are in the resource list, but I am available to be contacted, and I do believe, Jessica, it could go by way of you, or whether my NEA email is out there, I'm not sure. But
yeah, you can put it in the chat.
Okay, there are resources out there that are available, mainly through SAMHSA, if you're familiar with SAMHSA, concerning, because I know most people are right now really looking for things to do with mental health. That's SAMHSA, right? Even some of these other topics. Looking at this information, I brought it in from the perspective of mainly from the health side, So although it's from the health side, it is important to everybody, educator or not. And there's tons of resources out there. The ACEs connection, excuse me, now it's the PACEs connection, is one of those resources. SAMHSA, the CDC, a lot of these, this information I took off of the CDC site that I shared with you. It's not, it's there about social determinants of health and about the ACEs. So visit those sites. There's tons of information out there. The biggest key is if you're not feeling confident that you could present it, it would be behoove you to ask maybe like the counselor that works in your district, or someone else, as I say, at the state level or at the county level that feels comfortable with presenting.
Okay. I'm not seeing any other questions specific to the content. There are some questions here specific about having the link to the video or being able to watch it again. We will, when you download those materials, the links to all of the resources are on the PowerPoint slide right underneath the images, as well as the link to the video. So you will be able to capture those websites from the PowerPoint presentation. I'm not seeing any other questions related to the content. So if anyone has any last questions that they would like to send Sheila's way, please do that now. And if not, we will wrap up a little bit early and provide you with some resources, the link with the resources after you take your the evaluation. So I'm gonna give one more second to see if I see any other questions popping in. Right, not seeing any. And there was also a question about whether or not CEU credits are offered for this course. So the way that works is you can request a personalized certificate, and I'll give you some more information on that. I did post it in the chat earlier on in the beginning. You can send an email to espqweb@nea.org to request a personalized certificate. And it is based on your school district as to whether or not they accept it for CEU credits in your school district. There are some that do and some that do not. So it would be dependent upon your school district.
Yeah, Jessica, I see there's a second part to that question. And they were asking about follow-up.
Yes.
Action steps.
And so the second part is, will there be follow-up on this topic with more action steps?
So, I mean, it's something we can all speak about and communicate with each other. There are some other monthly sessions that are already, in the hopper, as you say. But it is definitely something we can look at in the ESPQ quality team.
And if you are on the website, if you have our ESP professional development website, nea.org/ESPPD, you will, if you go on that website and you look under view our upcoming webinars, you will see that the presentation for next month is Resilient and Ready, Practicing Resiliency in the Education Community. So there'll be some tips that will further along in this realm of our social and emotional learning and mindfulness and health that you will get from that as well. And the date and registration information is posted there. And the last question I see posted, what would you say the first step folks should take to make wellness priority?
So that's a tough one, because as we know, people have to be ready, willing, and able to make that jump. So they, when we think about this from a health perspective, and I know somebody that maybe was a smoker or someone that does use some type of substance, they might not see that they have a problem or that it's affecting their health. So it takes for them to come to that realization that it's affecting me, that I really need the help. And then they will be the ones to really accept it and move on from there. We're here to give information. We're here to make that awareness known of what things can happen to people's bodies, what can happen to, maybe even affecting how it could affect your work, how it could affect how you interact with your children, as like in the ACEs. But we know no matter who the individual is, the reality of it all is they have to be ready and willing to accept help.
All right. Yes, I'm getting ready to show you a slide. There's a question in the chat about whether or not we can show the website. And so not seeing any further questions in the Q&A box, we are going to go ahead and move on to the next slide, which is going to give you just some wrap up information. Oh, wait, we got one more slide. We have one more question that slid in here. Do you feel it is more healthier to partner with someone in doing and making healthy decisions, or do you feel it's the individual?
I must tell you, having a partner in doing anything is always helpful for many people. There are people that are gung-ho, I'm going to do things myself. But when, let's say, you decide to join a gym and you have that friend who contacts you and says, okay, 7:30, be there. I'm going to be there. Sometimes that's more of an incentive for you to say, I'm going to do this. I'm going to move on with it. Or, setting up maybe classes or something to learn how to cook healthier food. Let's go. We're going to meet at the supermarket that has those classes, or whatever the case may be, or the library, etc. So you have to gauge the person. Some people need that camaraderie and that push from someone else to help them along. And then there are others that don't. For the most part, we do, because we're social creatures, we have been having such a tough time with all of the isolation that we've lived in. And they talk about that the poundage that we've gained over the COVID-19, COVID-19 15 or whatever the saying has been. So when you do have someone as a companion or someone that you can partner with, for the most part, it is going to be the better way to go about it.
All right, and that closes us out with our questions. So we are officially segueing from our Q&A section of tonight to request a general session-specific certificate of completion as a participant of recorded sessions. Please send your request by email to espqweb@nea.org. All requests must include the session title and the on-screen certificate of completion code. Session certificates will not be provided if your viewer code is not included in the email request. Note, due to limitations in our ability to track attendance after live sessions, requests for personalized certificates will only be provided for participants of live webinars whose attendance can be verified. The certificate received for viewing recorded sessions will be session specific, but will not include personalized names. On behalf of the Center for Professional Excellence in Student Learning's NEA ESP Quality Department, I would like to once again thank our presenter, Sheila Caldwell, for tonight's webinar presentation, and thank all of you for your participation. Please stay safe, stay healthy, and good night from the NEA ESP Quality Department.